I'll just make a few remarks to begin with, and then we'll hand to Councillor Kim O'Keefe, who's the Mayor for the City of Greater Shepparton, Felicia Dean, CEO at Rumballara Aboriginal Corporation, and Sam Akulatora from the Shepparton Ethnic Council, and then Jeroen Weimar, the COVID-19 Commander. And then so each of us will say a few words, and then very happy for us all to take questions from there. So in terms of where we're placed at the moment in relation to active cases in the local public health unit, there's 480 active cases across Golden Valley Health's local public health unit. In Shepparton, there's 342 active cases, 41 new cases in the last 24 hours, and there's 11 people in hospital, and 2 of those are in ICU and one's on a ventilator. Pleasingly, from a vaccination point of view, we are well and truly above 95% across our local public health unit for first dose, and most of the local government areas are in the order of around 85% on second dose, and the Greater Shepparton area is now a touch over 86% for second dose. So in the next 7 to 10 days, pleasingly, we will be able to reach that greater than 90% mark for double vaccination, which is terrific. But of course, for those people who haven't been vaccinated yet or made an appointment to be vaccinated, we still want people to do that. It is really important that we close out the last remaining handful of people to be vaccinated, because that's going to give us the best coverage in terms of being able to keep on top of COVID and reduce the spread in the community. With the number of cases that are still and people that are testing positive in the order of around about an average of 25 people per day for the last 6 to 7 days, of course we want anyone who has symptoms of COVID at any stage to come forward and get tested and not put that off. We still do unfortunately see some examples of people delaying that, and that's not what we want. So as soon as you notice something that's a little bit different or a little bit new, those cold or flu-like symptoms, no matter how mild they are, we want you to come forward and get tested straight away. Pleasingly, from my point of view, we're also seeing, with the opening up and the relaxation of some restrictions, the whole community is adapting and getting used to that, which is terrific. Each member of the community is playing a really important role, not only in getting tested, but it's really important that we continue to do those little things like wear masks when indoors, check in, all of those types of things as well. So I'll hand over to Kim O'Keefe now, and then we'll proceed through the speakers as I mentioned and take questions from there. So thank you.
Good afternoon everybody. From a council perspective, the testing sites have still been very busy, so we do ask the community to be patient, make sure you've got water and perhaps some food supplies. Council is still working very closely with GV Health. We do have community members that are still a little bit unsure of what they need to do, so please reach out, whether it's through GV Health or through council or any networks that you may connect to. It's really pleasing to see that the dependence of food relief has dropped quite significantly, but if you are still needing support, please reach out. As a community, we're very proud of where we are at as far as vaccinations go. There's still a very small gap, but this obviously means that we can get on with life. I've just come from a function today, 140 ladies out at the golf club, for Seroptimus. So getting back to those wonderful community events is so important. We're feeling that sense of back to normality, if you like, but really encouraging people that are still needing support. It's not over yet, and we know that there are some people within our community that are still quite stressed, and we encourage them, please reach out. We are continuing to support those that need to be supported. So well done to our community. It's really wonderful to have Jeroen here today, obviously talking to us about what we have achieved and how well we have got through this pandemic, and now of course it's recovery. And my big message is please support the local businesses. It's so important. It's probably the best COVID recovery we can do to really invite people into our community again, and we know it's getting safer to do that. So the road ahead is a positive one, and I'm so looking forward to seeing so much better things ahead. Thank you.
Hello everyone. Like the town of Shepparton, Rumballara Aboriginal Cooperative has been working really hard to vaccinate our community and keep everyone safe. Our numbers are currently sitting around 75% fully vaccinated, first dose, and 55% around our second dose. So we've still got a little way to go. Our vaccine clinic is open every day during the week, and we have the little mobile bus. From next week will be located over in Shepparton at our Ford Road site, and in partnership with Goulburn Valley Health, the Rumballara Football Club and KULA Institute, we'll have the Jabba bus situated at the Rumballara Football Club on the 10th of November. So please call 58 2000 35 and book your vaccine. Come in if you have any concerns. Let us walk you through that process. The responsibility to keep our community safe lies with all of us. So I encourage you all to come in. Thank you.
Thank you for the invitation for us to be part of it. Shepparton Ethnic Council has been in partnership with the Greater Shepparton City Council and the Goulburn Valley Health to provide bilingual support workers at the vaccination centre, vaccination hub, since April, and more recently with the vaccination buses. These bilingual workers reflect the diversity of our community. Greater Shepparton is a unique, diverse, multicultural community, and in provincial Australian terms is a unique demographic for the diversity. And providing appropriate COVID-19 information, preferably in first language, has been challenging. During lockdown, we had some issues with the culturally appropriate food, not being able to provide the culturally appropriate food for some of our communities. But however, this amazing community and the agencies work really hard to rectify that issue. Despite all the challenges, our diverse multicultural community has responded brilliantly to all the campaigns to encourage both testing and vaccination. So we'd like to thank our multicultural communities for doing their part to keep them safe and the whole community COVID safe. Thank you.
All right, great. Look, firstly, good afternoon and thank you for coming out. And can I just say a huge thanks to the entire team here across Shepparton, the team at Goulburn Valley Health, the phenomenal council team at the City of Greater Shepparton, our multicultural and faith leaders, and of course, the wonderful work of Rumballara. I know this has been a really challenging 6 months for the Shepparton community. We've had to deal with a number of really quite difficult and challenging outbreaks, and it's nice to be getting to the point now where we can finally start to see our way forward with a bit more confidence, with the restrictions easing, and as we kind of roar towards a 90% full vaccination target in only a few weeks away, we can really look forward with some confidence to the significant easing of restrictions. I have to say particular credit to the vaccination teams that are working so hard across so many communities here in Shepparton. We're well ahead of the state averages. 86% of people in Shepparton are now fully vaccinated. Well over 95% have had their first dose. So I'd really urge everybody who's remaining, people who still need to complete their vaccination doses, please let's go and get those last few second doses done so we can all be fully protected against COVID as we step forward into a spring and a summer with a lot more confidence. We still have, of course, a lot of work to do across the rest of the state. So our state figures are getting pretty good. 82.7% fully vaccinated now, so a little bit further to go before we hit our 90% target, but we expect to hit that certainly before the end of the month, and that of course allows us to ease off even more on the remaining restrictions that we do have. Having said all that, of course, we've still got a lot of important work to do to maintain COVID safety, not only here in Shepparton, but across the entire state. We still have today 342 people in Shepparton who are currently living with COVID. Some of those are in hospital, the vast majority are out being supported in the community. We will continue to see COVID cases over the days and weeks ahead, particularly amongst the unvaccinated. So the most important thing that you can do if you're concerned about catching COVID is make sure you're fully vaccinated and make sure the people you love and care about are also fully vaccinated. We will, of course, continue to see COVID cases to some extent within our vaccinated community, but we know that the consequences and the chances of us ending up being seriously ill with complications are far, far lower. So it's the best way for us to protect ourselves. But still, even for those of us who are fully vaccinated, remember if you are getting symptoms, please come forward and get tested quickly so we can stop the virus from spreading on to anybody else that you care about, anybody else you live with, or anybody else in your community that you care about. We will of course continue to work across not only Shepparton but across the wider state as we step our way forward over the days and weeks ahead to easing restrictions and to living with a bit more confidence. There will be more challenges for all of us ahead, but I think this is a really important step forward that we've all taken together. And finally, again, my thanks to all the people of Shepparton for really enduring the complexities and the hardships of the winter, and for getting through it, and for being in a position now we can look forward with that bit more confidence. With that, I think all of us are happy to take any questions.
Yep, well, we may as well start with you.
Start with me, yep.
On. In terms of sort of exposure sites,
Yeah.
the last sort of couple of weeks, all the exposure sites, or a vast majority, have been
Yep.
in regional settings.
Yeah.
Is there a reason that it's just in regional?
Yep.
And what's the difference between regional and Melbourne that's causing that disparity in the listing of exposure sites?
Yeah, look, I think clearly as we're starting to see more and more, look, as we're seeing currently around 17,000 active cases of coronavirus in the state today. We continue to see around 1,000 or so cases a day coming through across the state, and the vast majority of those are in Metro Melbourne. Really, for the last 4 or 5 weeks, we have really increased our focus in the metropolitan area on the direct contact tracing of working out people who are close to those positive cases and working through their workplace connections and their social connections. We have a far reduced focus now on the exposure sites, and increasingly we're only working on those high-risk exposure sites, so health services, schools, aged care facilities, and we don't publish those openly. Those are dealt with directly. We work directly with those centre managers to make sure we address those kind of risks. And it's really about putting our focus on those areas where there is the greatest risk of transmission, and the greatest risk of transmission remains in the home and in the workplace, in those places where people are spending a significant amount of their time. I expect as we go forward, and we'll continue to see the shifting approach as we're dealing with a fully vaccinated community. We'll see a reduced focus on listing and identifying public exposure sites. We'll do it in those occasions where we think there's a genuine need, a genuine public need for attention. But of course, as we saw here in Shep only back in August, if we list every single exposure site where every single positive case has been, we rapidly start to close down too much of our economy and too many of our centres. So increasing our focus is around identifying positive cases, ensuring they're quarantining safely, and supporting their direct primary close contacts to do the same thing.
And in terms of then, sort of, will those tier 1 exposure sites, at sort of bars and hairdressers and stuff, they'll slowly stop being listed sort of in regional areas as well along those lines?
Yeah, look, I'd expect so. Look, and this is the importance of the QR code system. So now all of us are now, well familiar with the Services Vic app, which not only allows you to, of course, check into all these facilities, but also to demonstrate that you're fully vaccinated, and recognising that entry to most of these venues, particularly hospo and retail, is only for the fully vaccinated. That, of course, further reduces the risk of transmission in those particular locations. So we'll continue to use the QR code system. We'll continue to reach out to people that we think are directly at risk. That's why we'd encourage you to always make sure you check in, but you should see you'll see over the days and weeks ahead a far lower focus on tiered exposure sites, and I suspect in the coming weeks ahead that we'll pretty much stop doing them in a public setting.
Will that include the deep cleans as well?
Yeah, so we've already revised our approach to how we work with venues where there are positive cases. So if I look at the work we're doing with schools at the moment, the work we've been doing with health services, we now have a far more targeted approach about identifying where positive cases have been, really making sure we clean around those areas and those high-risk contact points. But we no longer need to shut down entire facilities for days on end to do comprehensive, full, deep cleans. Partly because we have a better understanding now of where our cases are moving around, and partly, of course, because we're dealing with people increasingly who are vaccinated and therefore have a far lower risk of shedding. And of course, most of us are vaccinated, so we have a far lower risk of picking up the virus.
And then in terms of when Shep had its outbreak, there was a few days lag of additional help for testing, and we've seen the same in Wodonga as well. How have you guys refined how you actually target that testing so that it's instead of 2 or 3 days of testing sites shutting at 9 a.m. How have you refined that so that you're instantly reacting when there's that demand surge?
So look, we have literally thousands of people today and every single day working in our testing system. Well over 200 fixed testing sites, including the one just behind me here at GVH, but also, of course, the rapid response teams that are moving all around the state pretty much all the time. We have over a dozen rapid response teams providing testing this morning. I saw the setup they were doing in Echuca, and they're active across the state to where the current highest risk outbreaks are. What I'd expect to see going forward, again, as we start to see, we'll see fewer outbreaks, we'll see smaller outbreaks, but we will continue to see positive cases in the community. So it is not unusual to see, as we see today, 30, 40 cases overnight in Shepparton. I expect those numbers to be continuing over the weeks and months ahead. They will start to drop down really as we finalise that vaccination programme. But look, we should continue to see, we'll continue to provide access to testing. We've also, of course, now got increasing access to rapid antigen testing, and they'll be increasingly available from major supermarkets over the weeks ahead. And that'll be another option for people to provide that extra reassurance of understanding about if you've got symptoms, you'll have other options to use those tests to establish whether you've got COVID.
Do you have a date of when restrictions or outbreaks will ease? Do you have when numbers will ease in the community?
Yeah, look, I think the projections we have at the moment, and we've done a lot of modelling, of course, with the Burnett Institute around to understand at a statewide level what we expect to see happening with cases over the weeks and months ahead. Our current modelling shows that we're going to see, as we're seeing at the moment, a cooling off of our daily caseload numbers to around the 1,000 to 1,200 number. We'd hope to hold that trend for a few weeks. We expect, though, as we continue to ease off the restrictions and as we all move around more, as we see more cross-border movements again, all to enable people to reunite, we will see more cases, particularly amongst the unvaccinated. So even with 92, 93% first dose vaccination, even after 90% fully vaccinated, that's still hundreds of thousands of people who have not chosen to get vaccinated, who are most at risk of catching COVID. So we'll continue to see cases really running amongst the unvaccinated members of the community. We think until the end of the year, so we will see significant case numbers all the way through to the end of December, and then we hope to see case numbers drop off more significantly in January and beyond.
If cases don't drop off, when restrictions are meant to come off completely, is there a threshold beyond which that you might have to consider some restrictions coming back for a town like Shepparton?
Yeah, look, you never say never. So look, the things we watch very closely every single day are obviously the case numbers, the total case numbers, both at a statewide level and at a local level, but also the hospitalisation numbers. And that this is all really around the capacity of our healthcare system to manage COVID positive cases. Today we have 660 or so people in hospital as at this morning. That is well within the capacity of our healthcare system, although we are having to defer some care to accommodate that particular capacity. We have around, I think, 120 people today in our intensive care facilities, again, all across the state. Those are the numbers we'll really be focusing on. So what we've seen recently is significantly high caseload numbers, but we're well below the projected numbers of people ending up in hospital. That's a good thing, but of course we'd still like to ensure we get those numbers as low as possible over the weeks ahead.
What are some of the lessons that you've really learned out of Shepparton to outbreaks that could be applied in other scenarios?
Yeah, look, I mean, Shepparton's has been a trailblazer on a number of aspects of outbreak management. I think the particularly what we saw here in August of this year with the speed with which the outbreak increased, particularly when it went through some of the bigger schools here in Shepparton, and the number of people who had to isolate, and of course the impact that had on not only our health services but a whole number of other critical services all across the town. So we've had to refine our primary close contact system and our secondary close contact system. So we're now all across the state adopting a far tighter definition of who are your primary close contacts. That's made a lot easier because increasingly people are vaccinated. So when you're vaccinated, we can be much more specific about your risk of catching COVID from another positive case. So we're reducing the number of people who are having to isolate because they've had contact with a positive case, and that reduces the impact on the overall community.
There seems to be a bit of a slippage in people wearing masks inside. Can you reiterate the importance of continuing to wear masks as the outbreak continues? Yeah, look, I think we're all delighted that we've seen this easing of restrictions. The fact we can, particularly in Metro Melbourne, we can go out in bars and restaurants again, and the fact we're not having to wear masks outdoors anymore. Again, these are all really welcome freedoms I think that we're all enjoying. But the remaining restrictions that are there for a very good reason. We are not out of the woods yet. Again, today we've got over 1,200 positive cases in the community. And although we can accept that within the capacity of our healthcare system, we don't want to see those numbers spiral and continue to increase significantly. So the remaining restrictions, particularly mask wearing indoors, that social distancing and those hand hygiene things, they're going to stay with us for a while. And it's really important that we maintain those really good practices, because that way we can hold down the number of cases, reduce the pressure on our healthcare system, and get through and actually enjoy this summer and enjoy 2022.
You mentioned schools a few minutes ago as well. Just in terms of looking more ahead to next year when all the air filters are in place, and hopefully we've got vaccines for 5 to 11-year-olds as well, and most students are vaccinated. Does that change how those that exposure period and close contact system works in schools specifically, so you don't get classes coming in for a week and then going home for 5 days and then coming back and
Yeah, look, absolutely. Look, and can I say first of all, a huge appreciation and thanks for the work of our schools and our teachers and all those administrators who are working so hard to keep our schools going. And this is an incredibly challenging environment for all of our schools to have the joy of seeing children back in school again, but the challenges of dealing with an increasing number of children who will be positive through exposure in the community. We do expect to see, as we see more of the wider community vaccination numbers continue to increase, the deployment of the air scrubbers and ventilation into schools. And of course, we're very hopeful that, that the TGA will approve vaccination for 5 to 11-year-olds, and that we'll be able to roll that out sometime hopefully early next year. All those things will help us to actually keep schools going and keep children in school where they are. We've already made a number of, there's an important trial starting next week across a number of schools in the state, whereby we will reduce the amount of time that children have to isolate following exposure to a positive case. So that again will reduce the impact on schools, enable more children to stay in school. But we're very keen to continue to do anything we can to ensure that we have a minimum impact on kids, particularly in the next academic year.
And I think hopefully finally, what did you think of Jabba the Bus?
Jabba the Bus is great. Jabba the Bus is like this combination of two of my favourite things, vaccination and public transport. So I couldn't think of anything better. But no, in all seriousness, a huge thumbs up to GVH for Jabba the Bus. I think anything we can do to make vaccination easier, to bring it closer to people, to make it a less intimidating, scary thing, all these things make a difference. And a real credit to everybody who's been involved in this most significant vaccination system. Over 5.3 million Victorians have been vaccinated, whether it's through their GPs, through community pharmacy, through the state clinics, through Jabba the Bus, or through even the teams going individually into people's homes to provide that vaccination in a safe and secure place. And a final call out to those remaining Victorians who haven't yet made that decision to get vaccinated. Please just do it. We're all desperate to move on and to get away from this pandemic. We all want to get on with our lives, and the more of us that are vaccinated, the safer all of us will be, and the less pressure there will be on the rest of our healthcare system.
I have a few questions from our Albury office.
Sure. I'm going up there this afternoon, so.
Yeah. How concerned are you about the current outbreak in Albury-Wodonga?
Look, I think that the team particularly the team at Albury-Wodonga Health, and of course all of our local partners are doing a phenomenal job in working together to manage a really quite complex outbreak that's been running on both sides of the Murray for a number of weeks now, and I'll be up there later on today to get a sense of how that response is shaping up. What I will say is, of course, we're seeing a really high vaccination level in Albury-Wodonga. The teams there have done a fantastic job to get people ready for these possible outbreaks, and again, vaccination is our best possible defence against these kind of outbreaks. But we will see these cases continue to rumble in parts of the community that are not yet well vaccinated, and we'll redouble our efforts to make sure that vaccination happens. There's a lot of work happening also with schools on both sides of the border to ensure we can get as many of those kids back into school as quickly as possible, and to also use some alternative testing platforms to help us to do so. So a lot of work going on there. One of the reasons I'm up in the north is to also check in to see how the teams are running there. But I think again, this is, I'm afraid, as we step forward into more freedoms, as we step forward into a world with fewer border restrictions, all of those are good things. We will continue to see cases rumbling along, particularly where people haven't yet chosen to get vaccinated. And that's what we need everybody to go and do, so we can actually put these cases behind us.
You touched on it there, but Melbourne residents have been able to travel to the regions for at least a week. Have you seen an increase in outbreaks, or will it increase outbreaks in the future? So look,
the case numbers over the last few days have been pretty quiet, so we've seen a couple of days below 1,000. That's been really welcome. We do think, of course, that testing numbers were low as well over the Melbourne Cup weekend, so not entirely surprising that our case numbers are a bit lower. We expect those to come up a bit, I think, over the next few days. Look, and clearly, with more people moving around the state, with all those amazing family reunions between regional and Melbourne, regional Vic and Melbourne, we are going to see more spread of cases into our wider community. That's why we're now seeing about 1 in 5 of all the cases every day are now in regional Victoria. A couple of weeks ago, that was less than 1 in 10. So we should continue to expect to see more cases coming into regional Victoria. But again, given the high vaccination levels in regional Victoria, we are well protected in those communities from big outbreaks. So yes, we'll continue to see small outbreaks running here and there, but we should see a reduction in the really big outbreaks that are causing significant concern. Okay,
thank
all
you.
good.